You've been looking at urothelial cancers, and particularly refractory ones. Why were you looking at combining this drug Pazopanib with Paclitaxel, and what exactly did you do?
There is no approved drug in the United States for patients who fail first-line chemotherapy, for patients with metastatic urothelial cancer. The only drug that's approved in Europe is vinflunine. In the United States, the most common drug that's used is Paclitaxel. It has a response rate of around 10% with a median progression-free survival of approximately 3 months. There are many drugs that have been tested, but none really approved to this date.
So could you tell me about Pazopanib, this anti-angiogenic? What is it and what does it do?
So Pazopanib is a VEGF targeted tyrosine kinase inhibitor. There have been a lot of interest in studying anti-angiogenic agents in urothelial cancer. In fact, there is a large trial looking at cisplatin and gemcitabine, combining it with bevacizumab in first-line therapy. There have been similar drugs such as sunitinib and sorafenib that have been tested in refractory urothelial cancer and have not shown to be successful. There was a single agent Pazopanib trial tested in urothelial cancer and had a response rate of around 17%. So this triggered our interest to combine Pazopanib and Paclitaxel in patients with refractory urothelial cancer.
Okay, what came out of it? What happened?
We looked at a total of 32 patients, and we included patients not just with bladder cancer, but also with upper tract tumors. In fact, our patient population included about 38% of patients with upper tract. We had a fairly high-risk patient population. We had 28% of patients with liver metastasis. And we tested our combination looking at Paclitaxel at 80 milligrams per meter squared given weekly on days 1, 8, and 15, along with Pazopanib 800 milligrams per day given orally for 28 days.
And what did you get in terms of response?
Our overall primary endpoint was response rate, and we had a response of complete and partial response of 50%, which is unprecedented in urothelial cancer. We also had a progression-free survival of 6 months and an overall survival of 8 months.
So what kind of toxicity, though, did this anti-angiogenic add to the regular Paclitaxel?
Overall, it wasn't a big surprise in terms of the side effects that we already know for both of these agents. The four most common side effects were fatigue, nausea and vomiting, peripheral neuropathy, and some alteration in blood counts.
So what's coming out of this? It's obviously just 32 patients at the moment, but looking interesting. So what are the clinical messages that are coming out of it, do you think?
The response rate is pretty robust. Clearly, this is an active regimen and is worthy of further study in a bigger cohort of patients. Number 2, I think the progression-free survival of 6 months is also pretty significant for this refractory group of patients. I'd also like to add that we looked at different subsets of patient population, and we found that patients with high risk, our trial outperformed the historical controls of what the expected survival would be.
So what's the take-home message for cancer doctors?
The take-home is that the combination of Paclitaxel given weekly along with Pazopanib is an active regimen in refractory urothelial cancer. It's well tolerated. Myelosuppression was significant, and so patients should be monitored closely for a decrease in their counts, but the overall regimen is well tolerated.
These findings will go forward eventually for further studies, and do you think it could get approved, Pazopanib?
We have GSK, which originally had this drug, is now given it out to Novartis. they have looked into this concept and are not looking to do a phase 3 due to their corporate priorities.
Gosh, what should doctors take home from that?
I think it's the competition that's currently around for drug development, and immunotherapy has become a very big competition in this field. Pazopanib is somewhat late into its development. It's been around for kidney cancer for a long time, and I think it is a shame that it will not be tested in a phase 3 trial.